therapist. Thank you for joining me at home. Today's episode, we're going to discuss different bed positioning. A common complaint is having pain in bed, maybe pain in your neck, pain in your back, difficulty falling asleep, or difficulty staying asleep because you wake up with pain. And there's certain positions that you could get yourself in using different pillows and towels that may help. So first we're going to look at just laying on your back. So sometimes you might need something like a roll. So right here I just rolled up a towel. Okay, so this towel roll is going to actually support my lower back. Okay, so it's going to go in that curve of my lower back. Now to get in a good position, there's a technique called the log roll technique. So instead of just getting yourself into bed and sitting up, instead just go lay on your side first, and then you're going to roll onto your back from there. If you try to keep your knees and shoulders going together, there will be less pain in your back. Now say in this position you're still having back pain. You might need to roll up a towel and then just put it underneath that curve of your lower back. Sometimes you can even wrap the towel all the way around so that when you move, it doesn't move as much with you and won't get lost. There's also products out there like McKenzie Roll where you can just buy something that's professionally made as well. So, but this is just a rolled up towel and it just adds that lumbar support. Also, having your knees bent takes off pressure off your back. So being in a straight leg position can increase that pressure in your back, especially if you might have something called lumbar spinal stenosis. If you do, you want to kind of get those knees up. You can passively have those knees up by having some extra pillows. So I'm just going to bring some more pillows over here. And I'm going to put those knees up there. So putting a couple pillows up underneath can help just take that pressure off your back. You have that roll, toss and turn in your sleep. You can even keep this roll here when you lay on your side. Now when you lay on your side though, you'll just want one pillow between your knees. So to lay on my side, I'm just going to rotate shoulders and knees together. And then I can keep this roll here just to, continue supporting that curve of my spine. If you notice here, without a pillow, I kind of have this angle. It could put more pressure on the knees, it can put more pressure on the hips. So to help with that, you can just take a pillow and just put that between your knees. And that's going to just help even out that pelvis, which will even out that back. It will also decrease pressure on your knees. So depending on what's going on, if you have any knee pain, hip pain, or back pain, just adding a simple pillow could be your solution. So another thing people might have trouble with is their shoulders. So especially if you just had shoulder surgery or something like that. So to help support your shoulder, you could take a pillow and you can just put your pillow underneath your arm. And that's going to take some pressure off of that top shoulder there. Now if you're having trouble on the bottom shoulder, you might even want to consider a couple pillows. Grab one more pillow here behind your back. And so you can kind of roll that way into it. You can even add this extra pillow here. And then if you notice, I don't have complete pressure on my bottom shoulder anymore. And this top shoulder is in a nice open packed position. It's real comfortable. As I sleep in this position, gravity won't, pull me forward or pull me backwards because I'm supported with these pillows. So this is a good position. If this shoulder is having an issue, maybe you're recovering from a rotator cuff tear or something like that, or if this shoulder is having an issue, then just taking some weight off of both shoulders. And then you can also, if I had one more pillow, I could put it in between my knees and then I can just be fully supported in the side position. If you have any other specific concerns with sleeping, you can always comment below. And thank you for watching.